Have you ever wondered why a seemingly insignificant breast lump could be a cause for concern? A breast lump, whether small or large, hard or soft, is essentially an abnormal growth of tissue within the breast. It can be as tiny as a pea or larger and can sometimes be felt during a self-examination. Even though most breast lumps are benign or non-cancerous, some could potentially be an indicator of breast cancer. Yes, that's right, breast cancer. Now you might be wondering, why should a painless lump be of any worry? Well, here's the thing. Cancerous lumps are often painless, especially in the early stages. This is why it's so important to not dismiss a lump simply because it doesn't cause discomfort. Getting to know your breasts through regular self-examinations can make all the difference. It's about being familiar with how your breasts normally look and feel. This way, you can detect any changes like the appearance of a new lump early on. You may also wonder, when should I consult a doctor? If you notice a lump or any other changes in your breasts, it's time to seek medical advice. Even if it turns out to be nothing serious, it's always better to be safe than sorry. Mammograms, which are essentially X-rays of the breast, are another crucial tool for early detection. They can spot lumps before they can even be felt. Regular screenings can catch breast cancer early, when it's most treatable. Never underestimate the significance of a breast lump. Early detection is key. Did you know that changes in bowel habits can be a sign of colorectal cancer? When we talk about changes in bowel habits, we're referring to symptoms like blood in your stool or persistent bouts of diarrhea or constipation. It's normal for your bowel movements to vary a little, but these symptoms are not just everyday irregularities. They could be indications of a serious health issue, such as colorectal cancer. Now, this doesn't mean you need to panic every time you have an off day. However, if these symptoms persist, it's essential to consult with your doctor. Persistent blood in the stool, for example, could be a sign of a bleeding tumor. Likewise, constant constipation or diarrhea could indicate a blockage or abnormal growth. Remember, your body has its own ways of sending out distress signals. These bowel changes are just one of the ways it tries to alert you that something might not be right. And as with any potential health issue, early detection is key. So don't ignore these symptoms if they persist. Listen to your body. Persistent bowel changes should not be dismissed lightly. Can persistent torso pain be a sign of something serious? That's a question that many people have asked, and the answer is yes, it can be. Persistent pain in the torso might be an indication of a serious condition such as ovarian cancer or other types of cancer. This symptom could be a result of tumors pressing on nerves, organs or bones in the torso. Now, we all experience occasional aches and pains, but what we're talking about here is pain that persists. Pain that's there when you wake up in the morning and stays with you throughout the day. Pain that doesn't get better with rest or even with medication. If you're experiencing this kind of persistent pain in your torso, it's important not to ignore it. This is your body's way of telling you that something might be wrong. It's crucial to seek medical advice as soon as possible. Early detection can make a significant difference in the treatment and management of many cancers. Remember, your health is important and you know your body better than anyone else. If something doesn't feel right, it's always worth getting it checked out. Prolonged, unexplained torso pain should never be ignored. Ever thought that chronic bloating and urinary tract issues could be more than just an uncomfortable inconvenience? Let's delve deeper into these symptoms. They may seem like minor annoyances, but persistent bloating and urinary tract issues could potentially be signs of more severe conditions such as ovarian or endometrial cancer. Bloating that doesn't subside, even with changes in diet and lifestyle, could be a red flag. It's not about the occasional fullness after a large meal. We're talking about a constant, uncomfortable swelling in the abdomen, often accompanied by pain. This could indicate the presence of a mass or tumor in the abdominal area, possibly linked to ovarian or endometrial cancer. Urinary tract issues, on the other hand, can present as frequent urination, a persistent urge to urinate, or pain during urination. These symptoms can often be mistaken for a urinary tract infection, but if they persist despite treatment, it's crucial to investigate further. These symptoms may indicate that a tumor is pressing against the bladder or urethra, affecting normal urinary function. Now, it's essential to remember that these symptoms alone don't confirm the presence of cancer. Many benign conditions can also cause these symptoms. However, the key here is the word persistent. If you notice that these symptoms are sticking around longer than usual, it's time to seek medical advice. Your healthcare provider can help determine the root cause of these symptoms. They may recommend diagnostic tests such as ultrasounds, Connecticut scans, or blood tests to check for potential markers of ovarian or endometrial cancer. If these tests suggest the presence of cancer, your doctor will guide you on the next steps for treatment and management. Remember, early detection is crucial when it comes to cancer prognosis. Paying attention to your body and being proactive about your health can make all the difference. Don't dismiss chronic bloating or urinary tract issues as mere inconveniences. They could be signs of something more serious. Could unexplained weight loss or abnormal bleeding be signs of cancer? A question that is often overlooked, but one that could be a potential lifesaver. Unexplained weight loss, the type where you're not trying to shed pounds and yet your clothes become loose, can be a sign of various types of cancer. When cancer cells invade the body, they compete with your healthy cells for nutrients, often leaving you in a calorie deficit. This can lead to weight loss that can't be attributed to diet, exercise, or stress. It's the kind of weight loss that seems out of the blue and is persistent. This symptom is common in cancers such as pancreatic, stomach, esophageal and lung cancers. However, it's important to remember that unexplained weight loss can also be a sign of other health conditions. So it's crucial not to jump to conclusions, but to seek medical advice. Now let's talk about abnormal bleeding. This is another symptom that should never be overlooked. For women, this might mean bleeding between periods or bleeding after menopause. For both men and women, it could signify blood in the stool or urine. These are not normal occurrences and should be checked out right away. Abnormal bleeding can be a sign of various cancers. For women, uterine and cervical cancers often come to mind, but it can also be a sign of bladder or kidney cancer in both sexes. Like unexplained weight loss, abnormal bleeding can also be caused by other health conditions. So, while it's important not to panic, it's equally crucial to get these symptoms checked out. Remember, early detection is vital in the fight against cancer. Unexplained weight loss and abnormal bleeding might be your body's way of saying, hey, something's not right here. Don't ignore these signals. Listen to your body and seek medical advice when things seem off. Take note of unexplained weight loss and abnormal bleeding. They could be your body's way of signaling an underlying issue. And what's the best way to stay ahead of cancer, you might ask? Well, the answer lies in regular medical checkups, screenings and self-examinations. It's not just about responding when something seems wrong, but proactively taking steps to ensure your health is in check. You see, early detection of cancer can significantly increase the chances of successful treatment and survival. Many types of cancer, such as breast, colorectal, ovarian and endometrial cancers, can be detected early through routine screenings and self-examinations. Regular medical checkups also play a crucial role in identifying potential health issues before they become serious. So don't wait for the symptoms to show up before you visit your doctor. Make regular checkups a priority. Be vigilant, be proactive. These simple steps could save your life. And remember, like a well-tended garden, your body needs regular care and attention. Don't neglect it. Don't ignore it. Your health is your wealth after all. Regular checkups and early detection can make all the difference.